integrated is precision medicine already in everyday healthcare? Is that pretty commonplace or?
I don't know if I can chime in on this question quite yet. Right now, we have our graduate students doing the work by hand, so we can teach that to the AI. So maybe somebody else might be able to answer that one.
How institutionalized is it?
Correct.
It's not, unfortunately. I mean, in other words, there are hotspots in the country where AI is largely a research tool, frankly. I mean, it would be wrong. In fact, one of my big criticisms, and it's been pointed out by others, is you create these cool retrospective models based on huge data sets, okay? And then you test them and say, look what we came up with. Fine, but until you apply it to live patients, a live electronic health record, real time, and see the results, you really don't know. Not to mention, how hard is it to change physicians' behavior? Right, not easy, herding cats. So the point is, we're doing great from a research standpoint, creating models and really outperforming people. But until it's applied real time to a hospital data warehouse or electronic health record, it's tested and it fits in the workflow, we won't know for sure, okay? So again, I try very hard to always give a balanced approach, because this weekend I was at an AI conference and I was sitting there going, you know what? We're in an electronic health record winter. You know what I mean? Because we overhyped it. I mean, it's a long story, but the point is, we need to try very hard with AI to look at the holes, the challenges, and fix them ahead of time. We already know there's problems with facial recognition. It doesn't recognize darker people than, because it was trained on Caucasians largely. It's just one example. But the point is, we're going to find other stuff. I have in the chapter I wrote on AI 4 pages on just challenges. So again, we're getting wonderful results, but I don't think it should be oversold. It will be commercialized. You're starting to see it. But until that happens and you get real world scenarios where you're trying to take this research model and put it in a 200-bed hospital that has very little AI and HIT and all the rest, until you do that, you really won't know, in my opinion.
Yeah, I think what everybody has to understand is that big companies like Microsoft, Google, they're in corporate America hospitals, they're actually spending a lot of money to create things, but they're actually working with startups who are doing innovative things to actually come up with solutions. So there's a lot of money being spent. So and if you keep using AI to do your research and your spending, you're going to home in on solutions faster. It speeds up the innovation curve.
Is it interesting that in pure volume, I would say the gray journal that has the most on AI is Forbes magazine. And I think it's because they see it as this incredible challenge threat, you know what I mean, the yin and the yang of business, and so there's a tremendous number of articles published on AI here.
Well, the reason being, Bob, is that AI is a form of computing, and computing is pervasive across everything we do. And so us as individuals, we have to understand it's computing, but it also is a tool that we can use in our everyday job. You don't have to think about all the big things that Google, once our first introduction to AI at that first research lab was in Microsoft Excel. The Warhead Design Creativity Machine, the neural network were designed in Microsoft Excel. And we just put a front end on it. So and there are plugins for Microsoft Excel that you can actually use right now. There's plugins for Google Sheets. You don't have to be an artificial neural network expert. You can start using it with your small amounts of data right now on the job to kind of get things done.
Yeah, and in fact, the conference I was at, it was largely to present to physicians what are the available free tools now for predictive analytics, which included neural networks. So RapidMiner is the name of it if you're interested. It's free for academics. But one of its menus, if you're doing a classification I showed you, it automatically gives you like 6 to 8 you can select from, and one of which is deep learning. So it's commercialized to that degree, just like you're saying, and it's mainstream. They don't, it's a black box. Do they tell you how many layers and the name of the neural network? No. But the point is, it's commercially available to compete with logistic regression, naive Bayes, all the common ones. It is part now of the menu.
And you alluded a little bit to telemedicine earlier. Jody, did you have some comments on automated telemedicine and where you see that going?
Yeah, I did, and that's outside of, mental health specifically, but decision support, through AI is just, pervasive, in healthcare. So before we get to the kind of future, the telemedicine, I'll instead tell a story from the past, to get there. So I have a sibling, who was born with a very, very rare genetic, disorder. She's actually here today, so she's doing well, managing her condition, quite well. So once we kind of got in the clear with that, and as we got older, my father, who is also in the healthcare professions, he explained to us, had we not lived in the town we lived in with a research hospital and a major university, she might not have been diagnosed in time to save her life, and that's just crazy. Even 25 years ago, to be limited in your healthcare by where you are. So that is where I think, intelligent systems, access to intelligent databasing that can index diseases and remember everything. Doctors are wonderful, they've been trained very well, but, they are human. They're limited by what they can remember. In my sister's case, it might have just been like from a TV show, that one doctor who remembered that one line from the textbook or an article. So the idea of, automated medicine helping support our doctors, I don't think we're at a stage where AI will be making all of the decisions. So in medical physics, we do have decision support in radiation treatment planning. So traditionally, your oncologist, they will look at your patient scans. They'll decide where they want to aim the radiation treatment, for cancer or a tumor. But then you'll have an AI do it on the side, the same exact thing. And then for this kind of support system, they come together. And they look, what did the AI say? What did the doctor say? Let's refine our decisions. So that's in form of treatment. But imagine a world where we do that with diagnosing as well. So you have an AI that's crunching the numbers as your human doctor is still using their intuition to kind of make a diagnosis, but on the side you have a system, again, a very powerful database. It's crunching these numbers as you go. So I think that we're not far from that. But again, we've got the computations, we've got the data. I think the ethics is something that we need to figure out. So if there are any students of ethics in the room, that's a big one. Data security as well. So I kind of see the future being this kind of dual supportive role back and forth. I don't know if you guys want to chime in on that one.
Well, just to give you an aside, is that with developmental problems, since the host place where I was a Children's Hospital of Orange County, they're also taking pictures of young kids with developmental problems and letting the computer analyze that, because that defines the phenotype. And combining that with genomic information so that in the future, to some degree, they could photograph the child, which has ethical ramifications. But the point is, and could say, this looks like early Marfan syndrome, or this looks like you pick it. But they could do that and then do the genetic testing or whatever. But so the ability to combine all that information and take advantage of it is definitely very interesting. Whether we get to a diagnostic chatbot, I don't think so.
That'd be cool.
It would be. And there are people, somebody in it was fairly recent, predicted we wouldn't need physicians by 2021 or whatever. I could just say as a personal aside, that's craziness. I actually had 15 years of private practice in a rural community. We covered 5 counties. So I literally would go from the ICU back to the clinic, and then go make rounds in a nursing home, and then go make my house calls and go home. Do you think those people wanted a computerized hologram taking care of them? Hell no. So, I mean, they wanted hands-on stuff because many were aged, they were dying. I mean, so when I hear we're going to replace, I can only laugh. Now, the only group that really is worried is radiologists. But some people, because it's been shown that it can pretty well perform as well or better. everybody's suggesting that that would be quality improvement, an automatic second opinion, you name it. In fact, one of the people speaking said, I think it will increase the number of radiologists. And that tended to happen, to be honest.
For sure.
As they get more knowledgeable, and then it behooves them to become really knowledgeable about AI. So that they're, you know what I mean, so they can explain it to their hospital administrators and all the other people that it's worth it and all that, but a lot of people say, you know, it's not going to, I don't think anybody really thinks it's going to replace physicians.
Now, before we move into what the literature says about